Topic is Dermatofibrosarcoma protuberans. Hello dear students, we'll discuss a topic, clinical case which is very common, commonly in surgical side or in oncological side. See this, what is this condition is. See that extensively skin and deeper tissues involved, there is an ulceration, multiple nodules, wide area is involved in the abdomen. There is a scar tissue, probably the patient has undergone some surgery earlier for the same condition. So what could be this condition is? It is dermatofibrosarcoma protuberans, a low-grade fibrosarcoma arising dermal fibroblast. Differential diagnosis other soft tissue sarcoma, cutaneous secondaries, or from the deeper plane malignancy coming out as a involving the abdominal wall. So the other differential diagnosis you have to think. No doubt it is the neoplastic malignant neoplasia. By look at that you can always make out. And features are trunk is the commonest site, but can also occur in the neck, limb, head, abdomen, anywhere it can occur. Dermatofibrosarcoma, the low-grade malignancy, it is classified under soft tissue sarcoma. Olden days it is classified under cutaneous malignancy, but it is classified under soft tissue sarcoma now. Multiple hard nodular swelling which may attain larger size. Regional lymph node may get involved. So we can examine axillary lymph node as well as inguinal lymph node both. We can go down because at the level the umbilicus it is. Can go down, it can go up, both sides. Blood spread rare but to lung. When it occurs to the lung, blood spread. All sarcoma spread mainly to the lung. Then of course later liver, bone, brain, lungs, and so brain and other areas. So biopsy of the lesion, we can do a true cut biopsy here or open biopsy can do because ulceration is there. FNH of the lymph node, CCT of the chest and abdomen or PET-CT you can do. Malignant spindle cells are seen in the histology. Treatment is wide local excision, but how wide you can remove because the entire abdominal wall is gone. So how to reconstruct the area with a big mesh, skin now will cover the problems. It can be initially radiotherapy and chemotherapy, but if the patient responds, then you can go in and do a wide local excision. Here the problem is the reconstruction of the abdomen. Skin is removed, soft tissue is removed. Peritoneum also may be removed in this patient if the peritoneum is not. Then how will cover the defect? Where will place the mesh? How will cover the soft tissue? That is also important thing to be thought of. So it is better to have a neoadjuvant therapy than remove it. Whether neoadjuvant therapy helpful here also there is a big debate. So treatment is wide local excision, but recurrence is common. That's the point. So how to do all those things, real technical and reconstruction problems. Of course, remember treatment is this one, the low-grade malignancy, but recurrence is common. Spread this to the lung. Okay, sometimes to the lymph node, mainly to the lung. That point is, but you have to examine the drainage lymph nodes, both axial and both inguinal regions is important when as far as clinical method is considered for this patient. So answer the MCQ, dermatofibrosarcoma protuberans is a variant of SCC, variant of BCC, fibrosarcoma, leiomyosarcoma. Students, please give the right answer. I will get back to you. So students, always go through my SR-based clinical methods and surgery, where everything, examination part, of course in video, how to examine is there in my book through JP Publishers, 4th edition. It contains all topic, for example, mass abdomen, swelling, ulcer, artery disease, venous disease, thyroid, and so on. All topics with the video contain lot of photos and illustrations. So students, I hope you have understood this topic, dermatofibrosarcoma, very well. Thank you so much.